World War I, the epic global conflict born from decades of volatile political and military alliances, was endless and gruesome. In 4 years, 70 million armed personnel from dozens of nations ravaged nearly every city and hamlet in Europe. 30 million combatants and civilians were killed or maimed. For the war's first 3 years, the US remained neutral, but repeated attacks by German U-boats in the Atlantic, such as the sinking of the Lusitania cruise ship, forced America into battle. When American forces arrived in 1917 to squelch Germany's advance into Western Europe, the continent was in tatters. Poor hygiene infested cities and battlefields. Medical camps were overrun. Millions suffered from malnourishment. Disease ran rampant, and soon, a supercontagion would find its way here with devastating consequences. I'm Kory Curcuru for 1623 Studios, and this is the story of the 1918 flu epidemic and its effect on Cape Ann. Throughout 1917, a strong H1N1 virus spread from war zones to base camps across Europe. New modes of transportation, massive troop movement, and POWs returning to their native countries made this strain of influenza transmit further and faster. However, the news went largely unreported, as governments censored information about the disease to, in their words, maintain morale and minimize widespread panic. By 1918, U.S. military training was in full force. Each day, thousands of troops and medical staff were deployed overseas. Americans in European port cities were increasingly prone to falling ill. That September, sailors returned to Boston on shore leave. Some went to Camp Devens, where many of Cape Ann's young men trained. It's believed that 2 sailors visited Gloucester. Massive influenza breakouts followed. Within a week, civilians got sick. 4 days later, Gloucester's first death was recorded, with more to come. Healthcare services on Cape Ann were ill-equipped to face an emerging epidemic. Addison Gilbert Hospital had only 30 beds. Leander Haskins Hospital in Rockport had even fewer. Only the rich could afford house calls. Officials hoped that because the flu moved so fast, it would burn out fast. Instead, it raged into Rockport, Manchester, and Essex. Some took ill and died within the same day. For weeks, newspapers led with obituaries. It was chaos. Massachusetts had more cases than all other states combined. Teachers and nuns were recruited as nurses. Schools and businesses closed. Curfews and mask wearing enforced, crowd sizes restricted. The Red Cross established an emergency hospital at the Gloucester Police Station and a children's ward in the Girls' Club above Gloucester National Bank. The state urged all able-bodied persons to join the fight against the epidemic. Young women leapt into action. They volunteered as laundresses, ambulance drivers, and an improvised occupation, nurses' aides. Soup kitchens popped up and delivered meals to the sick and poor. Governor Calvin Coolidge begged President Woodrow Wilson for help. Washington, already dealing with Gloucester's financial appeal for vessels sunk by submarines, lent military nurses to take over local care. It was the first time women were given the rank and pay of lieutenants. 10 angel nurses from Ontario, Canada joined the effort. They were all that kept the makeshift care system intact. A sprawling tent encampment was set up on the Addison Gilbert grounds, overseen by the Army Medical Corps. The tents had flooring, plumbing, and electricity. For cleanliness, nurses walked on wooden boardwalks along the tents and wore wire-frame masks with cloth that didn't touch their noses or mouths. Nurses' aides washed the masks every 2 hours. In Rockport, women held countless fundraisers to maintain the Haskins Hospital on Summit Hill. And in Manchester, the Visiting Nurse Association, established at Horticultural Hall on Summer Street nearly a decade before, visited patients by bicycle to deliver meals and administer care. Incredibly, 2 things spared Cape Ann from further catastrophe: timing and geography. When the flu arrived, summer residents had already gone home, and signature nor'east sea breezes circulated fresh air through the peninsula. There were no antiviral drugs to treat the virus, nor antibiotics for infections. The open air, it was believed, was the best remedy. By mid-October, 6 weeks after the Boston sailors arrived, the outbreak subsided. Closures were lifted and schools reopened. When the situation was deemed under control, nurses followed the flu westward. On November 11th, the armistice with Germany was signed. Between the epidemic and the war, it's impossible to calculate a final death toll. But over a third of the world's population, hundreds of millions of people, were afflicted. Tens of millions died. By winter, 4,000 Cape Anners were ill and 300 dead. Steps were taken to ensure the region would be better prepared for a pandemic. For the first time, schools hired nurses to visit sick students at their homes. A contagious diseases hospital called Braywood was built on Gloucester's Essex Avenue. By the spring of 1919, there were no new cases. Folks socialized again. The war ended, the flu passed, and people weren't enveloped with grim media reports from around the world. Cape Anners flooded theaters, cafes, and ice cream parlors. Gloucester officials realized that in order to thrive and support infrastructure, they must embrace tourism. Talks began about industrializing Cape Ann. More roads would be built for automobiles. Maybe a bridge spanning Annisquam River would draw wealthy residents. There was also a celebration to prepare for, as 1923 would mark Gloucester's 300th anniversary. The parallels between the 1918 flu and COVID-19 are striking and sad. Perhaps the most prescient words came from a naval nurse who treated soldiers in France and civilians in Boston.
The lack of doctors terribly burdened civilian life. The devotion to nursing by our women while their own loved ones lay dying or dead in faraway places was heroic. Many were untrained, yet rushed to deliver babies, dress wounds, work without sleep. I saw dreadful things and fear I will never be who I was before this warring campaign and God-forsaken disease. May we never forget the sacrifices of our men and women. I pray that thoughtful leaders and new medicines will prevent such horrors for 100 years or more.